101. Which cranial nerve is assessed by asking a patient to say, ah, to observe uvula movement? Answer: vagus nerve. Explanation: the vagus nerve controls pharyngeal muscles, assessed by observing uvula movement, critical for evaluating neurological swallowing function in clinical exams. 102. What is the primary nursing action for a patient with a suspected concussion? Answer: monitor neurological status. Explanation: monitoring neurological status detects changes after a concussion, guiding timely interventions to prevent complications and ensure patient safety. 103. Which brain structure is primarily responsible for regulating thirst? Answer: hypothalamus. Explanation: the hypothalamus regulates thirst via osmoreceptors, critical for maintaining fluid balance in neurological patients during clinical care. 104. What is the primary symptom of a patient with a stroke affecting the occipital lobe? Answer: visual field deficit. Explanation: the occipital lobe processes vision, so a stroke causes visual field deficits, guiding neurological assessments and patient safety interventions. 105. Which reflex is tested by tapping the quadriceps tendon? Answer: patellar reflex. Explanation: the patellar reflex, elicited by tapping the quadriceps tendon, assesses the L2, L4 spinal segments, critical for neurological motor function evaluation. 106. What is the primary purpose of administering dexamethasone to a neurological patient? Answer: reduce cerebral edema. Explanation: dexamethasone reduces cerebral edema in conditions like brain tumors, a critical intervention to lower intracranial pressure and ensure patient safety. 107. Which cranial nerve is responsible for sensation on the face? Answer: trigeminal nerve. Explanation: the trigeminal nerve provides facial sensation, assessed by touch or pinprick, critical for detecting neurological sensory deficits in clinical practice. 108. What is the most appropriate nursing intervention for a patient with a Glasgow Coma Scale score of 5? Answer: ensure airway protection. Explanation: a score of 5 indicates severe impairment, requiring airway protection to prevent hypoxia, a critical safety measure in neurological emergencies. 109. Which brain area is responsible for processing tactile sensations? Answer: parietal lobe. Explanation: the parietal lobe's somatosensory cortex processes tactile sensations, assessed to detect neurological deficits like numbness in clinical evaluations. 110. What is the primary nursing action for a patient experiencing a partial seizure? Answer: ensure patient safety. Explanation: ensuring patient safety by removing hazards prevents injury during a partial seizure, a critical intervention in neurological nursing care. 111. Which spinal segments are tested by the triceps reflex? Answer: C6, C7. Explanation: the triceps reflex assesses the C6, C7 spinal segments, a key deep tendon reflex for evaluating neurological motor function in the upper limbs. 112. What is the primary function of the substantia nigra? Answer: produce dopamine. Explanation: the substantia nigra produces dopamine for motor control, critical for assessing neurological conditions like Parkinson's disease in clinical settings. 113. Which cranial nerve is assessed by testing the corneal reflex? Answer: trigeminal nerve. Explanation: the trigeminal nerve provides sensory input for the corneal reflex, a key test for neurological integrity in unconscious or high-risk patients. 114. What is the primary goal of occupational therapy for a patient with a stroke? Answer: improve activities of daily living. Explanation: occupational therapy enhances skills for daily tasks post-stroke, a critical intervention to promote neurological recovery and patient independence. 115. Which brain structure regulates blood pressure? Answer: medulla oblongata. Explanation: the medulla oblongata controls blood pressure via autonomic centers, critical for monitoring vital signs in neurological patients to ensure stability. 116. What is the primary nursing intervention for a patient with trigeminal neuralgia? Answer: administer carbamazepine as prescribed. Explanation: carbamazepine reduces nerve pain in trigeminal neuralgia, a critical intervention to alleviate neurological discomfort and improve patient quality of life. 117. Which cranial nerve is responsible for taste on the anterior two-thirds of the tongue? Answer: facial nerve. Explanation: the facial nerve controls taste on the anterior tongue, assessed to detect neurological sensory deficits in clinical examinations. 118. What is the primary symptom of a patient with amyotrophic lateral sclerosis? Answer: progressive muscle weakness. Explanation: progressive muscle weakness due to motor neuron degeneration guides neurological assessments and interventions in amyotrophic lateral sclerosis care. 119. Which reflex is tested by tapping the Achilles tendon? Answer: Achilles reflex. Explanation: the Achilles reflex assesses the S1, S2 spinal segments, a key deep tendon reflex for evaluating neurological function in the lower limbs. 120. What is the primary purpose of an MRI in a patient with a suspected brain tumor? Answer: visualize brain structures. Explanation: an MRI provides detailed images of brain structures to diagnose tumors, guiding neurological treatment and ensuring accurate patient care. 121. Which cranial nerve controls lateral eye movement? Answer: abducens nerve. Explanation: the abducens nerve innervates the lateral rectus muscle, assessed for lateral eye movement, critical for detecting neurological deficits in clinical exams. 122. What is the primary nursing action for a patient with a suspected subarachnoid hemorrhage? Answer: monitor neurological status. Explanation: monitoring neurological status detects deterioration in subarachnoid hemorrhage, guiding timely interventions to ensure patient safety and prevent complications. 123. Which brain area is responsible for executive functions like decision-making? Answer: prefrontal cortex. Explanation: the prefrontal cortex governs executive functions, assessed to detect neurological deficits in cognition, guiding patient care planning. 124. What is the primary purpose of administering memantine to a neurological patient? Answer: slow cognitive decline. Explanation: memantine slows cognitive decline in Alzheimer's disease by regulating glutamate, a critical intervention for managing neurological cognitive impairment. 125. Which cranial nerve is assessed by asking a patient to shrug their shoulders? Answer: accessory nerve. Explanation: the accessory nerve controls the trapezius muscle, assessed by shoulder shrugging, a key test for neurological motor function in clinical exams. 126. What is the primary symptom of a patient with a brainstem stroke? Answer: vital sign instability. Explanation: a brainstem stroke affects respiratory and cardiovascular centers, causing vital sign instability, guiding neurological assessments and emergency care. 127. Which spinal segments are tested by the biceps reflex? Answer: C5, C6. Explanation: the biceps reflex assesses the C5, C6 spinal segments, a key deep tendon reflex for evaluating neurological motor function in the upper limbs. 128. What is the primary nursing intervention for a patient with epilepsy? Answer: ensure medication adherence. Explanation: ensuring medication adherence prevents seizures in epilepsy, a critical intervention to stabilize neurological status and ensure patient safety. 129. Which brain structure is responsible for coordinating eye movements? Answer: midbrain. Explanation: the midbrain superior colliculus coordinates eye movements, assessed to detect neurological deficits like gaze abnormalities in clinical practice. 130. What is the primary purpose of a neurological assessment in a trauma patient? Answer: detect neurological deficits. Explanation: a neurological assessment identifies deficits in trauma patients, guiding diagnosis and treatment to prevent further injury and ensure patient safety. 131. Which cranial nerve is responsible for pupil constriction? Answer: oculomotor nerve. Explanation: the oculomotor nerve controls pupil constriction via parasympathetic fibers, assessed to evaluate neurological function in clinical settings. 132. What is the primary symptom of a patient with a temporal lobe stroke? Answer: memory impairment. Explanation: The temporal lobe houses memory centers, so a stroke causes memory impairment, guiding neurological assessments and patient care planning. 133. Which brain area regulates hunger? Answer: hypothalamus. Explanation: the hypothalamus regulates hunger via metabolic signals, critical for assessing nutritional status in neurological patients during clinical care. 134. What is the primary nursing action for a patient with a suspected epidural hematoma? Answer: prepare for surgical intervention. Explanation: preparing for surgery addresses rapid neurological deterioration in epidural hematoma, a critical intervention to ensure patient safety and prevent brain damage. 135. Which cranial nerve is assessed by testing hearing? Answer: vestibulocochlear nerve. Explanation: the vestibulocochlear nerve transmits auditory signals, assessed to evaluate neurological sensory function and guide patient communication. 136. What is the primary purpose of administering gabapentin to a neurological patient? Answer: reduce neuropathic pain. Explanation: gabapentin reduces neuropathic pain in conditions like diabetic neuropathy, a critical intervention to improve neurological comfort and patient quality of life. 137. Which brain structure relays tactile sensations to the cortex? Answer: thalamus. Explanation: the thalamus relays tactile sensations via the dorsal column medial lemniscus pathway, critical for assessing neurological sensory deficits in clinical evaluations. 138. What is the primary symptom of a patient with a frontal lobe stroke? Answer: impaired judgment. Explanation: the frontal lobe governs executive functions, so a stroke causes impaired judgment, guiding neurological assessments and patient safety interventions. 139. Which reflex is tested by stroking the sole of the foot? Answer: Babinski reflex. Explanation: the Babinski reflex, elicited by stroking the foot sole, assesses upper motor neuron function, critical for detecting neurological abnormalities in adults. 140. What is the primary purpose of a ventriculostomy in a neurological patient? Answer: drain excess cerebrospinal fluid. Explanation: a ventriculostomy drains excess cerebrospinal fluid to reduce intracranial pressure, a critical intervention for neurological patient safety in conditions like hydrocephalus. 141. Which cranial nerve controls eyelid elevation? Answer: oculomotor nerve. Explanation: the oculomotor nerve innervates the levator palpebrae superioris, assessed for eyelid elevation, critical for detecting neurological deficits in clinical exams. 142. What is the primary nursing intervention for a patient with a seizure disorder? Answer: educate about trigger avoidance. Explanation: educating about avoiding triggers like flashing lights prevents seizures, a critical intervention to enhance neurological stability and patient safety. 143. Which brain area is responsible for processing olfactory information? Answer: olfactory cortex. Explanation: the olfactory cortex in the temporal lobe processes smell, assessed to detect neurological sensory deficits, guiding patient care in clinical practice. 144. What is the primary symptom of a patient with a spinal cord injury at T4? Answer: paralysis below the chest. Explanation: a T4 spinal cord injury causes paralysis below the chest, guiding neurological assessments and interventions to support patient safety and mobility. 145. Which cranial nerve is responsible for the gag reflex? Answer: glossopharyngeal nerve. Explanation: the glossopharyngeal nerve provides sensory input for the gag reflex, assessed to ensure safe swallowing in neurological patients. 146. What is the primary purpose of administering rivastigmine to a neurological patient? Answer: improve cognitive function. Explanation: rivastigmine enhances cognition in Alzheimer's disease by increasing acetylcholine, a critical intervention for managing neurological cognitive decline. 147. Which brain structure modulates posture? Answer: cerebellum. Explanation: the cerebellum modulates posture by integrating sensory input, assessed to detect neurological deficits like ataxia, ensuring safe patient mobility. 148. What is the primary nursing action for a patient with a suspected meningitis? Answer: Initiate isolation precautions. Explanation. Initiating isolation precautions prevents the spread of infectious meningitis, a critical intervention to ensure neurological patient safety and public health. 149. Which cranial nerve controls chewing? Answer. Trigeminal nerve. Explanation. The trigeminal nerve innervates mastication muscles, assessed for chewing strength, critical for detecting neurological motor deficits in clinical exams. 150. What is the primary symptom of a patient with a parietal lobe stroke? Answer. Sensory loss. Explanation. The parietal lobe processes sensation, so a stroke causes sensory loss, guiding neurological assessments and patient safety interventions like injury prevention.